your skin look like this? Or have you seen skin like this? By the time we finish today's video, you'll be able to recognize the symptoms of hand eczema, sometimes called hand dermatitis. You'll also recognize some of the main things that go into the risk factors behind hand eczema. You'll be able to appreciate some of the physical signs, and you'll also be able to discover some of the main treatments for them. First, the risk factors. The main risk factors to think of are those that involve frequent hand washing. In terms of occupational risk factors, that would include any professional workers that wash their hands several times during the day. As you can imagine, that would include persons like myself, healthcare workers, child care workers, food service, nail salons, pretty much any occupation that would involve frequent hand washing. There's also some psychological risk factors to consider. People who have, unfortunately, anxiety or obsessive compulsive disorder, pretty much any kind of behavioral risk factor that would involve a compulsion of repetitive scratching, rubbing, or friction. Also, the physical exam and physical signs and features. They really could be summed up in one word: lichenification. Lichenification can best be defined as thickening of the skin, where the skin forms a relatively tough and leathery consistency. Also, where the skin lines become more exaggerated, where the skin lines and grooves become so exaggerated and prominent they resemble tree bark. There's also some of the hyperpigmentation or darkening of the skin. And the skin can also take on a pebbly consistency where it feels like very tiny pebbles or bumps are on the surface. There's also the standard treatments that we consider. We actually encounter hand dermatitis or hand eczema commonly in the office. And because the repetitive hand washing is such a risk factor in hand eczema, we will have the patient apply a mid-potency topical steroid, triamcinolone 0.1%, after every hand washing, not twice a day. A lot of times you notice that we dermatologists will prescribe a cream to be used twice a day on the affected area. Hand washing seems to be the main risk factor, so in these cases we ask the patient to apply the triamcinolone after every single hand washing. In other words, keep the cream with them. The oral medications that I would keep in mind that would be helpful would include the loratadine antihistamine that you would take twice daily, and also a prednisone 5 milligrams to be taken once a week. That's assuming the patient doesn't have any risk factors for diabetes, and if they did, you would hold the use of the prednisone or else limit its dose to a one-time. I'm Dr. David Bryant. I'm the proud owner of World's Famous Dermatologist, a dermatology practice in Stockbridge in Decatur, Georgia. We help patients from all races and ethnic groups, but we're probably best known for our expertise in Black skin. The dermatologist that you go to and trust does not need to be a Black American like myself to be qualified to work on Black skin, but whoever you're trusting with these kind of conditions should have experience with a large volume of Black patients and be very experienced with skin conditions that affect darker skin types. I hope you enjoyed today's video. If you did, please like, comment, and subscribe to the channel. Please leave your comments below. I will consider your comments and questions the next time we cover similar content. I look forward to connecting with you on the next video.